Hello မင်္ဂလာပါရှင် Burmese USA channel or Facebook education page ကနေကြိုဆိုလိုက်ပါတယ် I am going to speak some English because anyway if you are a nurse it doesn't matter in which country and I'm pretty sure you learn everything in English so better off I will speak English for all other nurses in other countries as well. So today I am going to talk about this basic dysrhythmia class that I went through and this is the objective, so let's just flip. This material, study materials is given by my hospital, so I will not give you the copy, but I have kind of share with this, like this, just so we can study together. It's for the purpose of studying in the nursing community. Okay, so this is called EKG in the United States. Okay, electrocardiograms in America is a little off because cardio is C. We call it in Singapore or other countries maybe ECG, but here is EKG, just to note, okay? Because I'm still learning some hospital lingos and the cultures here, so yeah, bear with me. So those are ECG. This is those graphs are like ECG strips. You know that, right? Okay, so first let's see, what is ECG? ECGs reflect only electrical activity, not the mechanical. Electrical means all that like that. It shows up on the strip, but it's not mechanical. So that means only when you put your hands on your patients and you will feel the pulse and you will get your blood pressures reading if you take the blood pressure. But ECG cannot tell you the blood pressure, cannot tell you the pulse. I mean, can tell you the pulse rate by reading that, but cannot tell you if there is pulse or not, because sometimes EKGs has this kind of line, but the patient doesn't have pulse. It's kind of like a pulseless, right? Pulseless, we call it pulseless electrical activity. So that's the rhythm for that. And it can happen, some of the dysrhythmia. Okay, let me tell you, dysrhythmia, arrhythmia, the same. Okay, that means the irregularity, the abnormal our heartbeats and our heart rhythms. Okay, so that's the abnormal going on in your heart. That means dysrhythmia or arrhythmia. Okay, some common causes of those arrhythmia, like something off on your heart rhythm on the ECG strips, it can be because of the hypovolemia. That means you don't have a volume. I mean, the volume is low. That means we have 5 liters blood in our body for the normal adult, and we have less than that, so the heart can't pump because there's no blood or less blood. Okay, and hypoxia, that means it's low oxygen. So if the heart pump the oxygenated blood to the brain, to the other vital organs, also to itself, because the heart also need a own blood supplies to work and function as it should be functioning. Okay, so tension pneumothorax. You know what that's tension pneumothorax? Pneumothorax. I look it up so that your lungs has the pleural cavity, that it has air in it. So it's actually causing the stress to the heart. Okay. EKG can tell us conduction disturbance and the rhythm disturbances. EKG cannot tell us structural disorder. So by taking the ECG, we don't know how their heart or structures is going to be look like, and perfusion disorder, we can tell them. Okay, so like for example 2D echo, those echocardiogram, they can actually tell you that how much the heart is pumping, what's the percentage is pumping, all that good stuff. But EKG can tell you only like electrical activities and conduction disturbances and the rhythm disturbances. Okay, electrical conduction system of the heart. Okay, this is SA node, and when SA nodes convey the message to is how do I say that? It's like the electrical activities kind of go to AV node, then AV nodes, and then after that it goes through this right and left bundle branches, then Purkinje's fibers right there. So it's this pump and this pumps, right? So okay, as a note, heart rate is 60 to 100 beats per minute. We're talking about adult heart, okay, just in general. For pediatric, NICU, and gotta learn something a little different because babies are so small, pediatrics are so small, their heart is so small, and everything for them is very fast, okay? And as a note, produce 60 to 100 beats per minute, and the AV note produce 40 to 60 beats per minute. So if you have a problem with the SA note, okay, and you are only relying on the AV note, then it is going to be bradycardia, like almost normal bradycardia, because it's always at the low side, right? And that's also have a lot of factors. Not just that. Purkinje fibers has 40 beats per minute or even less, okay? So here 60 to 100, 40 to 60, 40 or less, okay? And heart rate can be affected by the autonomic nervous system. That means our nervous system can make our heart rate go wild, okay? And it can have your heart rate lower or faster. So in the sympathetic branch, when we have that sympathetic nervous system light up and fight and flight situations, your heart rate is going to be fast, and congestion, so it's going, the congestion, which is the electrical activities, is going to follow through faster than normal, and the blood pressure is going to be high and irritability is going to be high. When the parasympathetic nervous system has, your heart rate is going to be low. So for parasympathetic nervous system, when it's activated, that means relaxed, and your heart rate is gonna go slower, and the congestions, of course, gonna follow through slower, and blood pressure is gonna be lower, and irritability is going to be less, and then you're starting to be hungry. You're starting to have the better digestive system, increase gastrointestinal tone. That's why I try to remember for myself, because nurses, we are always stressed out. We are always, most of the time, in the most of the time we are in the sympathetic nervous system mode. So our gastrointestinal tones and everything is kind of shut down, so we are not having much blood in the stomach, but we are having all the bloods on our brain or whatever, to kind of critical thinking every single half minutes. So then we're starting to have more like a problem to the gastric. Okay, so let's talk about basal. Okay, I'm hungry. Like a basal drink. Beta receptor. Okay, beta receptor. We have beta 1 and beta 2. Beta 1 receptor increase the heart rate and myocardial contractility. So beta 1 is one heart, so beta 1, and beta 2 is two lungs. So we have beta 2 is for lungs. Okay, so beta 2 receptors cause a vasodilation and relaxation of the bronchial, uterine, and gastrointestinal smooth muscles. So beta 1 is more to the sympathetic, beta 2 is more to the parasympathetic. So anyhow, how I remember it, okay, by a case scenario, because one of my patients has to use the vasodilator, like albuterol, the inhaler, because she has the asthma. So what happened in asthma is like, the windpipe and is kind of closing, and you can't really like breathe through that very, very narrow windpipe. So vasodilator like albuterol will vasodilate, it will act on the beta 2 receptor, and it will make the constricted muscle of smooth muscle of the windpipe bigger, so then she can breathe, right? But what happened is also act on the beta 1 receptor, so the heart rate become lower. Every time their albuterol, and her heart rates become lower. So I want to make sure her heart rate is not bottom out before I give her that albuterol, because it's acting on both. Okay, so cardiac rhythms can be affected by other things. So those cardiac rhythms can be affected if you are having like a electrolytes problem, like low potassium, magnesium. Low potassium, low magnesium serum level. Serum means blood. Okay, so low potassium in the blood, low magnesium in the blood means then you can have like a ventricular rhythms. So that means this ventricle, this is atrium, this is ventricle. Atrium squeeze the blood inside the ventricle. Ventricle squeeze the blood up to the body. So when you have the low potassium, low magnesium in the blood, you can have the ventricular rhythms, like usually is very fast. And high potassium, and remember high potassium, remember when patients needs a potassium, and potassium will never have an IV push. It's gonna be with the IV infusion pump, and it's going slowly into the vein, right? It can be peripheral veins, but it can't be IV push. It has to be pre-mixed. And most of the time, when I used to work in hospital in Asia, in Singapore, and it's already pre-mixed by the pharmacist, so we don't need to mess with that. It's already pre-mixed. Okay, so high potassium, magnesium can cause the bradyarrhythmias. That means like slower heart rate, slower rhythms. So remember, when you but you will never do that, but ever make a big mistakes, like put the potassiums, push it into the vein, and the heart is going to stop, because not even slow is going to be stopped. Okay, and that's why when we have the patients with the their potassium drip, you have to monitor the heart rhythms. Okay, and it can't be like slow and go. Okay, and chemotherapy drugs can also make the heart rhythms go haywire. Hypoxia, heart doesn't have oxygen for itself. Anti-dysrhythmic drugs like amiodarone, atropine, liver, all that good stuff. And medications that affect heart rates are called chronotropes. Just try to remember chronotropes, okay? Then you will have to learn a lot about chronotropes. And potassium and the oxygens, those are main component for the heart. Okay, so when you look at the ECG paper or EKG paper, and when you look at this square right here, and it is actually, this is called voltage, this is called time. We don't really care about voltage though, because time is really important, because that's how the atrium and ventricles are squeezing and communicating. So this little small box is 0.04 second. So when you have this box right there, I don't know if you can see. Let's see. It has this one as display, but look at this. Okay, this little box is 0.04 seconds. You have 1, 2, 3, 4, 5. That means 4 times 5 is 0.2 seconds. So this 5 box is 0.2 seconds. So just remember, little box is 0.04 second. Okay. Then ECG component, we have PR. That means it don't start from the tip. Okay, it starts from where the P start. That means that is P wave, which denotes for the atrium contractions, and then you have the P, this is R, Q, R, S. So you have a PR that all the way P to all the way starting to have like PR, R is starting somewhere here. It's PER. Yeah, so that is atrium activity. Then the whole QRS is ventricle activities, and then you have S to the T, T, starting from T. This is where T starts, so S to the T, ST segment. That's actually is to show whether the heart has any oxygen for itself or not. So usually if the heart is like ischemia or like almost heart attack or no oxygen, like hypoxia, ST segments is not going to be flat like this. It's going to be either raised like that or depressed, okay? And the QR intervals, QT, Q to the T, end of the T, QT intervals is actually showing the whole ventricular contraction and relaxation, okay? So let's see, atrial contractions is P wave, denotes atrial contractions, and when the atrial contractions is coordinated with the ventricular contractions, it can count for 30% of the person's cardiac output. It is known as atrial kick. So P, atrial squeeze, atrial kick, okay? And when it's working right, it 30% of the cardiac output. Okay, it doesn't have like a time limit. As long as there's a P wave, you're good. Okay, PR, that means P starting from the P to the QRS. So the Q right here, starting to the P to the Q. Okay, so let's say if I'll show you the example in a minute. Okay, so right here, PR interval, okay? You have to remember this timing, okay? 0.12 to 0.2 seconds. That means 0.04 is one box, right? 3 to 5 boxes. 3 to 5, these little boxes, okay? 1, 2, 3. It can be more. If it is more, that means your ventricular is actually pumping very slow, okay? PR interval denotes the whole atrial cycle. This PR is the whole atrial cycle. Measurements is from the beginning of the P to the beginning of the QRS, from here to here. PR is from here to here. Okay, PR. Okay, now this is actually Q, this is actually R, but remember, because I was mistaken, it's gonna be count until here. No, it's only count beginning of the QRS. Okay, that's called PR interval. It should be called PQ interval. I don't know why they call PR interval. Make me more confused. For the pediatric patients, PR interval is going to be shorter because they have smaller hearts, so SA node to the AV nodes is shorter. Okay, QRS, that means ventricular contractions, okay? And the number to remember is less than 3 boxes. It can be even like just few lines, like just very fast, okay? So that's less than 3 boxes, okay? This is 3 to 5 boxes. So just remember 1, 2, it can be 1, 2, 3, 4, 5. So this PR interval can be that long, but QRS gonna be 3 boxes or less, okay? Okay, now is ST segment. Like I said, if ST should be flat, if either elevated or depressed, it is like hypoxia. And the time, is there any time for that? No, it don't have that. Okay, T is here. It's called ventricular depolarization. Remember, guys, it's medical terms. Just I don't know who invented that, but it's kind of makes it really not understandable to normal people, because the way it has the same meaning but it has different kind of terms. Like depolarization means contraction, repolarization means relaxation. Just remember that, okay? So when we have this P, you have atrial contraction, then QRS, ventricular contraction, then your ventricular has to have relaxation, kind of repolarize, so that you have more blood coming in. That's what it is showing, okay? Okay, so QT, that means Q, starting from the Q to the end of the T. Okay, it denotes a complete ventricular cycle. Okay, PR is atrial cycle, QT is ventricular cycle, and it's the rate it is a rate dependent measurement. QT interval usually 0.44. Remember, 0.04 is one box, right? So it's 10-11 boxes. That's how long is the prolonged can be the ventricular rhythm. So you see, like, you have atrial contraction and the ventricular is longer than that, longer than 10-11 boxes. What's going to happen? Like, that means your SA node and AV node is not really communicating. You have atrial contraction, but your ventricular just don't want to follow that, right? Okay, so every cardiac cycle should produce a pulse. That's why you have to put your hands on the patients and feel the pulse. Okay, because sometimes there's no pulse, but the electrical activity is there. That doesn't mean there's no cycle at all. That means there's no cycle. So that doesn't mean patient is okay. If you see the ECG is okay, that doesn't mean patient is okay. Okay, chest pain protocol, patients on, okay, that's we don't need to know that. Okay, now to the cardiac electrodes. Okay, most nurses knows how to do or already trained how to do the 12 leads ECG, but in America we have 5 leads ECG most of the time, and I am not sure why they actually has to memorize this way. Remember, cloud over the grass and smoke over the fire, and you have the brown in the fourth intercostal space, but it's on the right chest. Okay, but we used to have 12 leads ECG, which is to the right arm, left arm, right leg, left leg. Everything is already labeled. I don't need to mess my brain with the color because my brain is not quite artistic brain. I like math. I'm not liking most of the colors. And also we have the fourth intercostal space is V1, and fourth intercostal space V2, and fifth intercostal space mid clavicular line is V3, and so on. It's easy to remember, but here we have 5. Okay, 5 leads ECG. So just remember that. And this is how lead 1 and lead 2 and lead 3 and whatever, they are like this fourth intercostal space, mid-clavicular line, leads 1 in communicating. So, just remember, if one leads off, that means they are not, the connections is off. You're going to have like a haywire ECG that, no sense to interpret, no sense to, it's the artifact. It's going to have artifact, okay? So rhythm analysis format. We will have a 7 kind of steps to go there. Remember, when you see an ECG, or you try to see if it is regular. Regular means you see you see the odd interval or all that regular, right? Regular. So that's regular. And what about the rate? And usually how I go by is 1, 2, 3, 4, 5, 6, 7, 8. That's 8 hours times 10. This is 80 beats per minute, give or take. Okay. And P wave, is there any P wave? Yes, there's a P wave right there. There's a P wave. There's a P wave. There's a P wave. Everywhere has P wave. Okay. And PR interval. Okay. Remember this PR interval. It has to be 3 to 5 boxes. PR interval is beginning of the P to the end, starting from the QRS. So let's see. Can you see? Let's see from here. 1, 2, 3, 4, 5. It's about that. So that's good. Okay, and QRS. QRS has to be less than 0.123 boxes. Okay, so your QRS starting from this Q to the S. So 1, 2, 3 is about that. And then identify rhythm. So when you have to identify what the rhythm is that. And to me, it looks like there's a Q, but there's a PP everywhere. Got P, everywhere got QRS, everywhere got T. But remember, your TST segment is like elevated. So this is more like an ischemia heart, and your heart needs oxygen. Patients need oxygen, but the heart rate is good. So you can just assume that your patient is okay by reading the heart rate, but your patient is actually maybe presenting with like a breathlessness or chest pain and all that because of the ST segment. Okay, and then then once you know what it is on the ECG, that means identifying the rhythms and treatment. Like I said, oxygen, and then what else is doing, and then discuss with the provider. And like this one, look at the rhythm, okay? It's not regular, right? It's not regular. Can you see that? And the rate 1, 2, 3, 4, 5, 6, 7, 8, 9. So it plus 10, 90. And look at P. Okay, is that a P wave? Okay, you see there's a P right there before QRS. There's a P right there, QRS, P right there, QRS, but it's not regular. But there's a P, okay? And then PR interval. So one from the P, I can't really see much, but 1, 2, 3, 4 is almost about the regular 0.1 to 0.2. And QRS, yes, it's a QRS and it's less than 3 boxes. That's good. But when you actually identifying the rhythms is, it's right here at that step. You have P, QRS, and kind of T, P, QRS, kind of T, but you have like so many extra waves, okay? So this is more like a fabulation, but you see this is QRS is a ventricular activity, right? But you have a problem with the atrium activity problem. Your atrium is not kind of squeezing like one clean shot. It's squeezing like this. That's fabulation, Fabulation is something to do with the atrium problem because you have a QRS, you have a ventricle, so that's atrial fibrillation. Atrial fibrillation could be like irregular rate and could have a lot of waves in between, and also it could be regular. It could be regular like 90 beats. It could be like not tachycardia or nothing like that, but it's your atrium is actually having a fit, okay? Calculating, so like I already told you, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 plus 10 is 140. Okay, but that's another way to calculation, which is I'm not a fan of that. But if you would like to know, I can tell you. Okay, you have to remember this number 300 and 1,500. Okay, I can't remember the big numbers. Big numbers are not not a thing for me. But if you like this way, you can remember that way, okay? So if you remember 300, you have to count the big boxes, okay? So from the RR interval, this is like 2 and a kind of 1. Okay, let's see. Let's try to count. This is like 2 boxes, okay? 2 big boxes, right? So that means you have to divide 300 divided by 2. That means 150 heart rate, okay? And if you want like more detail, like others, not me, then 1,500. Remember that. And you have to count the smaller boxes, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 1,500 divided by 10 is 150 beats, okay? And I like this better times 10, okay? RR interval. Okay, here P wave. Are there a P wave? Regular. Is there a P wave for every QRS? Yes, there's a P wave, there's a P wave, there's a P wave before QRS, okay? And P wave is normal, upright, in the lead too. So, you see if the P wave is normal like that, upright or inverted, because if it is inverted, it could be different rhythms, okay? So you have to do that. All the P waves looks alike. Yeah, they all looks alike. Irregular P waves associated with the atopic beat, I don't see that. It's all the same, okay? And PR interval, remember, from the starting of the P to the from the starting of the P wave to the starting of the QRS, PR interval is less than 3 to 5 boxes. Oh, excuse me. Okay. PR interval constant. Yeah, they are constant. They are constant. Okay, and less than 3 to 5 boxes. Yes, and if it is vary, change in measurement. So that's PR interval. And QRS. Look at the QRS is either 3 boxes or less, okay? So QRS like Q, R to the S, okay? So are all QRS complexes are equal durations? Yep. They are all equal, okay? And what are the measurements? Less than 3 boxes. And do all QRS look alike? Yeah, they all look alike. And are unusual QRS complexes associated with the atopic beat? I don't see any difference in beats. Atopic means like kind of abnormal beats in between. If there's abnormal beats in between, you have to identify if the beat is early or late. If it is early, then I don't remember what that's called, but if it is late, then it's escape. Okay. So you see, this is a R, but it's kind of like those variations, and you see all that R. So those are the things that you could see on the ECG paper, EKG paper, and normal sinus rhythm. Okay, I think I should go through this mix, like normal, and you gotta practice, and you got abnormal. Okay, I remember now. If there's an ectopic beat, if it shows up early, that's premature. It shows up late, that's escape. Okay, so yeah, we're gonna do more about what are the normal sinus rhythms, and we're gonna practice together with those Brady, Tacky, AFib, VFib, VTAC, all sort of stuff with the case study. Okay, stay tuned. Burmese USA, like and share and subscribe. Good night, bye.
I can feel the blood creeping up from the heathens. Got will, got fight, got pride, got reason. If they wanna go eat, then you know I'm gon' feed them. If you're coming for me, hope you're ready for a demon. I got eyes in the back of my head, I'm seeing. Take me for granted and you know I'm leaving. I'ma take what's mine with the webs I'm weaving. I could take this crowd from seeing to believing. Got a taste for blood and my tongue keeps bleeding from the words I spit. So sharp, so freezing, so cold. Behold, frostbite they feeling.